Hi, I'm Rosemary Clay, the Executive Director for the Bergen Newbridge Medical Center Foundation, New Jersey's largest not for profit hospital, and the sponsor of In the Know with Ro, an informative conversation with leading physicians on important health topics. Today I'm joined by Jason Weinberg. He is a board certified by American Board of Urology and a fellow of the American College of Surgeons. He practices general urology at Bergen Newbridge Medical Center with particular interest in prostate disease, kidney stone disease, voiding dysfunction, and minimal invasive surgery. A member of the American Urological Association and the Endourological Society, Dr. Weinberg has been practicing urology for nearly 18 years. If you're a man 40 or older, seeing a urologist is most likely the last thing on your mind when you have a million other things to worry about. You may resist at first, especially if you have been dragged to your primary care physician for annual checkups, but seeing a urologist can make your everyday life better. As you go through your 40s, quality of life issues become more important. Prostate and sexual health will play a big role in this. Dr. Weinberg, can you explain how?
Well, as we all know, our body changes as we get older, and if we're blessed with good health, then our body will remain healthy, as even longer. Some people have health challenges which can weigh on urination and sexual function. The good news is there's a lot of good treatments for both urinary issues and sexual issues that men face, and for the most part, we're able to get men back to a youthful life on both of those fronts, if they're able to come and see us.
So it's Men's Health Awareness Month. What are some of the top health issues that you treat?
Well, in addition to helping men tune up any urinary issues or erection issues, which are, as I mentioned, pretty straightforward for us, we do talk to men about prostate screening. There's a blood test called the PSA test, which many people are familiar with. And we do recommend that men between the ages of 55 and 69 have a conversation with their physician, with their urologist or their primary care about PSA screening. And that's a check for early prostate cancer. So we do believe that if a man is a good candidate for a blood test, that it can pick up prostate cancer early at a time that is treatable. So that's one of the things we do encourage men to talk to their physician about.
So it's just a blood test that they need to come in for, doctor?
Yeah, the blood test is the most important thing. We do a prostate check, which is a finger check, which men, it's a good thing to do it, but some men say, hey, I'd rather not do it, and it's still really important to get the blood test.
So how frequently should a man get this tested?
Well, the conversation about PSA testing usually starts at age 55. It can start earlier, as young as age 40 if somebody has risk factors. Once they have their first blood test, that will guide us as to when they should have their next one. In general, it's every 1 to 2 years if it's normal. Obviously, if it's in a gray zone, a little bit concerning, then we may do it a little more often.
Can you tell us what some of the risk factors are?
The two main risk factors for prostate cancer are if men are of African American or Caribbean descent, and the second one is if they have a direct family history, father or brother of their father or personal brother that has had prostate cancer.
And what are some of the common symptoms that somebody might have, other than some of the risk factors that you just mentioned? I'm sure there's symptoms that
Sure.
might go along with, the uncommon pieces.
Yeah, great question. So the thing with prostate cancer is it's kind of like diabetes or high blood pressure in that it's really the testing that shows us that there's a problem. Most people with diabetes or high blood pressure usually don't have any symptoms. So prostate cancer is like that. That's why we encourage the blood test and the finger check, because there usually are no symptoms while it is still treatable. And that's the benefit of the PSA test, is it gives us a chance to treat somebody before they have any symptoms.
So, what are some of the symptoms that somebody might have if there's a red flag that goes up that they think there's something going on?
Well, again, if somebody has symptoms from prostate cancer, oftentimes it's too late to treat it and cure it. So the main thing is we don't really look for symptoms of prostate cancer. It's mostly just, hey, get a blood test. I don't know if that makes sense.
No, that does make sense.
Yeah.
So, some of the other issues that men or women might have is, as we get older, is frequent urination overnight and leakage. Are there treatments that both surgical and non-surgical for these particular pieces?
Yeah, this is a very common problem that we see as urologists, and I would say just about everybody can be improved a lot with this problem. In men, sometimes it's the prostate, sometimes there's infection, sometimes there's irritation in the bladder, sometimes it's overactive bladder. Rarely somebody could have a bladder cancer. So for this type of problem, I would really encourage people to go see their urologist, because it's true we have to do some testing and some checking and some thinking, but we also have medications and treatments to make it better in just about everybody. So this is a good thing to get checked for safety reasons, and it's also something that we can almost always improve with treatments.
So, whenever we see blood in our urine or stool, we naturally get concerned. If a man notices blood in his urine, what should he do?
Well, blood in the urine is always a concern for a rare cancer. So blood in the urine should never be ignored. It always has to be checked by a urologist. And what we do is we put a light into the bladder, and we get some kind of CAT scan or sonogram or something to make sure the kidneys are okay. The most important thing is to not miss a cancer if somebody has blood in the urine. Now, usually it's not a cancer. It's often like a prostate or something, but the only way to be safe is to check right away and make sure we're not missing something.
So, talking a little bit about kidney stones, what causes them and what is the best treatment for them?
So the truth is we don't really know what causes a lot of kidney stones to form. We've learned a lot over the years studying kidney stones and looking into how they form. But the real question as to why one person will make a kidney stone and the other person doesn't make a kidney stone, we don't really have that worked out. People who do make kidney stones, we can help them stop making kidney stones by collecting urine for 24 hours, doing some blood tests, and asking them about their own medical history. Do they have bone disease, bowel disease, that type of thing? In terms of treating kidney stones, sometimes we're actually able to not treat them and just leave them and watch them, which is good news for people who rather not have a procedure, of course. But there are some general rules about when we try to treat stones. If they reach a certain size, for example, 1 centimeter, or if they're in a certain location, then we treat them. Again, the good news is that most of kidney stone treatments have been worked out reasonably well. So, we're able to get people on the road and not have to keep coming to see us again most of the time.
So, as we age, intimacy can become more challenging for couples. Do you have any recommendation for men regarding this as they age?
Yeah, I would say the biggest recommendation is to find a physician that they really feel comfortable with, because if they're able to open up and talk to that physician, we can help men, I would say 99% of the time. In other words, if there's 100 men, 99 of those 100, we can get them in a much better place with their sexual function. The hard part is getting the man to feel comfortable enough to open up about it. And so that's why I say if they find somebody they feel comfortable with, this is what we do. So everything we talk about stays within the 4 walls of our exam room, and what they leave with is a plan to get them back where they want to be. So they should feel encouraged about that.
So, there was a mention that you had a particular interest in avoiding dysfunction. What does that mean?
Well, both men and women, as they get older, have a range of troubles with their urination. Women, especially if they've had children, can have urinary leakage. Physical therapy can help them, sometimes medications. And men, of course, as the prostate gets bigger as they get older, that also causes urinary issues. So the reason I appreciate treating that is because almost all the time we can make patients a lot better and get them to feel a lot better about their life. And so I enjoy that aspect of seeing patients.
So an enlarged prostate or is not exactly a cancer. That's just another piece of it, doctor.
Yeah, as men get older, the prostate does grow, just like, people get older, their ears get a little bigger. The prostate's kind of like that. It just grows. We don't really know why, but it happens. And, the urine travels through the center of the prostate. So if the prostate grows, it can pinch off the urine stream and cause urinary problems. So we have lots of ways of improving the urine flow through the prostate. And, it's pretty easy for us, to be quite honest with you, to make men better with that.
So one has nothing to do with the other. If you have
No,
a large,
no.
okay.
Yeah, because cancer is, a change in the tissue, and prostate is just that it pinches off. Now, cancer can also pinch off the urine,
Right.
but usually it's just prostate getting bigger that pinches off the urine.
Okay. So if someone would like to come and see you, doctor, would they need a referral from their primary care physician?
Usually it comes with a referral. Can someone call and make an appointment on their own? I'm not sure. That's a administration question, really.
Okay, yeah, no,
But we're
that's
happy.
fine.
But the truth is, most people know when they need to see a urologist. But it's usually better to speak to their primary care first.
I would think so. And they would probably be able to get a PSA done from their primary care physician too. Is that correct?
Absolutely, yeah.
It is the recommendation though to go and see a urologist as you get older, or going to see your primary care physician and asking for this PSA test as part of, their, wellness exam. Is that the recommendation?
Yeah, usually the primary care doctor has the discussion with patients if they want to do the PSA test, or if the primary care doctor recommends the test. And, they have all those preventive health wellness discussions with their patients. And if the primary care physician has a concern regarding the PSA level or the change over time, then usually that's when they refer them to see us.
Okay. So I really do appreciate you coming out and speaking to us about this important piece. Men's health is definitely something that we don't often talk about. You hear, everyone talking about women's health in October, mammographies, and I think that this is really important that more men start talking about the importance of their health. From every aspect that you talked about. Was there anything that I was missing, doctor?
No, I think you've done a great job. We've covered a lot in a short time.
Thank you so much. And I want to thank everyone that tuned in, and thank you, doctor, for coming in and speaking to me. And for more information about the services here at the medical center, and to learn more about our foundation or the medical center, please visit newbridgehealth.org. And thank you again for coming and discussing this important issue.
Thank you for the invite.
Thank you. Take care.
Thank you.
Bye-bye.